Hi, good evening, Las Vegas. I want to welcome you to the inaugural, to the grand opening, as it were. The first episode of something I'm so proud to roll out today on PHLV, Benepisyong Medicare. And with simply put, it is, this is a show that is targeted towards you, my kababayans, here in Las Vegas. And really, this information is going to be helpful to any Filipino, to anyone that's not Filipino in all 50 states. Okay, and anyway, I'm so proud to be the host of this program. My name is Richard Aguila, by the way. Many of you know me in the community as a Medicare advisor, and I've recently gotten the opportunity to be the host of this show, Benepisyong Medicare. Proudly sponsored by Alignment Health, our partner in Medicare and our partner in the Filipino community. And for the first episode tonight, I want to specifically talk about something so fundamental and so important to our community, especially our seniors. And that is, how does Medicare work? How does it actually work? Many people are confused. When I talk to them out in the many locations that I'm at, whether it's Seafood City or Island Pacific, or some of the other places that you might see me in public, always the question is, or rather the question is not, basically what's put to me is, it costs too much. There must be a catch. Parang hindi totoo yan. Parang mali. Whatever it is. I get all kinds of different reactions when it comes to Medicare. And tonight, for the first episode, I'm going to shed a lot of light and answer a lot of those questions. I may not answer 100% of those questions, but I'm guaranteeing you tonight, I'm going to answer about 99.9% of those questions. Okay. So anyway, let's begin. And again, I want to thank our proud sponsor, Alignment Health HMO, the Medicare Advantage plan for 2021, for helping to bring our community this information. Thank you so much for your support of this program and for your support of our Filipino community here in Las Vegas and in the vicinity. Okay, so let's talk Medicare eligibility, shall we? Medicare eligibility is really simple. You can be eligible in one of two ways. And again, I want to stress something. When you become 65, number one, when you become 65, okay, to many people, especially Filipinos, because we look young anyway, okay? We don't ever, we're not proud. We don't say, oh, wow, ang galing naman, 65 na ako, It's not something we have, we advertise, okay? Well, let me tell you something. You should be advertising it to everyone that you're turning 65. Not only because it's a milestone, but because it's an achievement. It is an achievement here in the United States for someone to turn 65 and be eligible for Medicare. And how that happens is you have approximately a 6-month window, actually 7 months, in which certain things take place. So 3 months before you turn 65, okay, you become eligible for what they call Part A, okay? And we'll go into exactly what Part A is later, okay? And Part A is something, is coverage through Medicare that you get in the mail automatically. You don't have to apply for it. As long as you have worked your normal 40 quarters or in some cases disabled before 65, fully disabled before 65, the majority of you will get a Part A card from Medicare, red and blue card. Okay, and there's going to be some and you'll see this information basically popping up in and out of this program today. Okay, now you're at least 65 years old and you're under 65 and you qualify on the basis of disability or other special situation. Okay, and you're a U.S. citizen or legal resident who has lived in the U.S. for at least 5 consecutive years. Okay, those are the requirements of being eligible for Medicare Parts A and B. So that's Medicare eligibility. Okay, all right. So Medicare B is something you actually have to apply for 3 months before when you get that Part A in the mail. And to a lot of you Filipinos out there that I've run into, this happens a lot, and don't feel bad. Okay. Pag natatanggap natin yung mail, okay, unfortunately, it's not something that's so well packaged by Medicare, and it says welcome to Medicare, and it's so you'll want to open this envelope. Unfortunately po, hindi ganon. It comes in a very plain white envelope, and it says very, very small letters, Medicare, Social Security, on the address line, and that's it. And it has your name on it. You will think it's just any other piece of junk mail, okay? But please watch out for it, because 3 months before you turn 65, you're going to get that first. Secondly, you need to apply for Part B, which will complete your eligibility, okay? And I'll go into that a little bit later, okay? So let's move on. Now, when can someone enroll in a Medicare Advantage plan or prescription drug plan? Okay. Now, your initial enrollment period is 7 months long. Okay. 7 months long. I like to say 6 months. Okay. It includes your 65th birthday month, plus 3 months before and 3 months after. It begins and ends 1 month earlier of your birthday. So let's just say, okay. Now, I'm born in December. And let's just say I'm turning 65 in December, okay? And somebody signs me up approximately 90 days, within the 90-day period of my birthday in December. It doesn't matter if it's December 1st or December 7th, or December 7th, by the way, is my birthday, okay? Or even December 15th, doesn't matter, as long as it's in the month of your birthday. If someone signs you up for a qualified Medicare program, okay, then you are eligible to be effective on the first day of the month of your birthday, okay? So, and we'll go into more detail on that as these programs progress, okay? And and I'm going to tell. Here's what we're going to do. One thing I promise you is I'm going to take you on a Medicare journey. I'm going to take you on a journey that will not only give you information about Medicare and how it works, but literally how it can positively impact your life, and most of all, the life of everyone in your family. Okay, in a very, very positive and just an inspiring way. Okay, and I'm speaking from the heart when I tell you this, because I'm so passionate about Medicare, because it is something that helped my father when he was alive, and my mom, now, and let me tell you, I do this because of the inspiration that I get from the experiences that they've had. So I everything that I'm going to talk to you about in this episode and the coming episodes, I have direct experience of, and it's something that I'm proud to share, because my experiences, are very valuable to someone that I'm speaking to, because I want that person that I speak to know that I speak with intelligence, and and a working knowledge of what these benefits do and what they mean. Okay. Now, it begins and ends 1 month earlier if your birthday is on the first month. You may enroll in Part A and Part B or both. Okay. Like I said, A, most of the time it automatically comes. Okay. You may also choose to join a Medicare Advantage plan. Okay. Now, we'll go into that very, very shortly, or a prescription drug plan, Part D. Medicare Advantage is often referred to as Part C, okay? And the prescription drug plan is often referred to as a Part D. So you have Medicare A, you have Medicare B, you have Part C, which is Medicare Advantage, and you have Part D. A, B, C, D. Okay? So things are very, very easy to remember. All right? Now, when can you enroll in a Medicare Advantage plan, the Part C, or a prescription drug plan? Okay, so let's go into the basic coverages of Medicare Part A and B. Okay? Medicare Part A and B are designed to give you health coverage when you're past 65 or have a special situation that you are disabled, fully disabled, and get put on and are eligible for Medicare if you're younger than 65. Okay, the only thing is that it's designed to only cover 80% of your overall cost for doctor visits and hospitalization. Okay, now. That being said, it is a requirement that as soon as someone turns 65 and is Medicare A and B eligible, they must, and you, unfortunately, you have no choice about it, okay? You must be signed up for, at the very least, a prescription drug plan, okay, in that time period, okay? It is a requirement of Medicare and Social Security. Now, for every month after your birthday that you do not have a prescription drug plan, a Part D, unfortunately, there is a very, very small penalty that incurs every single month. Okay, so it is very, very important for those of you turning 65, okay? And there's thousands of you doing this every single day, okay? And one day I'll get there too, all right? It is very, very important that you pay attention to this guideline. Always remember that you must, at the very least, sign up for a prescription drug plan. And that comes with, of course, a premium, depending on the types of medicines that need to be covered, okay, depending on your particular health condition, all right? So you can enroll for Part D plans and Medicare Advantage plans. Normally, it's referred to as the annual enrollment period, okay? The annual enrollment period is a time of year between October 15th and December 7th, okay? And from October 15th to December 7th, if you are 65, you can sign up for 65 and over, you can either sign up for the first time, if you're turning 65 in those months, okay, for either a Medicare Advantage plan or a prescription Part D plan, okay, between October 15th and December 7th, okay? And those of you who have already been enrolled in a Medicare Advantage plan, okay, you have an opportunity to review your plan with a Medicare advisor, such as myself, and see if that plan has worked well for you. You have an opportunity to do this every single year. And let me tell all of you that currently live here, or in this case, since we are, of course, a premier destination, Las Vegas. Everybody seems to be moving here from either Hawaii or California, Seattle, New York, and pardon me. And it seems to be the place to be. Though you could not pick a better place to retire or be on Medicare, and I'll tell you why. Because of the amount of people that are on Medicare Advantage or going to be eligible for Medicare Advantage, and Medicare, I'm sorry, on Medicare, the opportunities for benefits here abound. And let me tell you, every single year, you really do have an opportunity to better your situation, to really look at plans that have built-in dental coverage, that have built-in hearing and vision and wellness programs that are included in these plans. Okay, and most of the time at no additional cost, no additional premium. Okay, so you can't really pick a better place to be on Medicare than Las Vegas. Okay, now, that being said, if you haven't, let's just say you couldn't make up your mind, between October 15th and December 7th. Okay, if you just, I can't make up my mind. Okay, well, I tell you what, for the second year in a row, Medicare and Social Security have made it possible for those folks that haven't, had a chance for whatever reason to evaluate their plans or haven't had time, whatever it is. You have another opportunity to enroll again in either into a plan from January 1 to March 31st. Okay, and like I said, the beauty of being in Las Vegas are choices. And I have to tell you that, I'm so proud of our sponsor, Alignment Health. They their strength is innovation, and just constantly being at the forefront of what it is. Basically, they ask themselves every single year, what more can we do? What more can we do to make the Medicare Advantage benefits more rich, more abundant? So that they will have more things available that our seniors in our community will need and will help them with their quality of life. That's why I'm so proud to be, hosting Benepisyong Medicare with Alignment Health as our sponsor. Okay, for this just incredible show. This incredible show. I'm so excited to be here for you. Now, that being said, Medicare Choices. I told you I'd go into this with you in detail. Medicare Part A and B, again, they only cover 80% of your overall health insurance needs. The other 20% is you have two choices, okay? Now, three choices, really. The first choice is that 20% is your responsibility, okay? If you don't look into any programs, okay, and let's just say you don't, you go to the doctor, you go to the hospital, and it's very simple math. Whatever it is that is left over from that 100%, 80% gets taken over, gets paid, okay? And then 20% is your responsibility. Now, there's two ways you can take a look at this. There's the first option where you can literally buy an insurance policy, okay, called a supplement. And that supplement has a premium. So you buy a supplement and you buy a Part D, which again, that has a premium, okay? And with those two components, the supplement will basically cover the 20% gap that Medicare A and B don't cover. In addition to that, the Part D will give you the required prescription drug plan, okay? And traditionally, that is what most of you are used to. That is, once we retire and we go to HR, of our company's HR, and you ask them, Mr. and Mrs. HR lady or sir, I'm retiring now. What are my options? And normally what they're going to tell you, and it's because of a lack of information that this happens very often, even with all the options out there. They say, well, you know what? You got to sign up for this supplement, which costs you this much. And you got to sign up for this Part D, which costs you this much. In the scenario is this. Both of these things are going to cost you approximately $150 to $200 every single month out of your pocket. In addition to the Part B premium, and I will go into that in just a little bit, that you're already paying and required to pay through your Social Security benefit, okay, for the Part B coverage. Having a supplement and having a Part D, because those two things, as you age, they go up every single year. Every single year as you age, that premium increases, okay? Although it is a very good option, provided, and I always tell, especially my kababayans out there, I know how hard you work for your money. You nurses out there, the casino professionals, as I like to call them, because I served this community as a hotel, casino, and food and beverage professional for over 15 years. So I understand how hard you work. I get it. I've spent the 18 hours, as a line employee, and the same amount of hours, if not more, as a manager and director for some of our biggest casino and hotel companies here on the Strip. And I can tell you, I appreciate where you guys are coming from and the amount of sacrifice that you've made for your families. And that's why it's important for me that I get you the right information in order to help you and make life easier, okay, because you've worked hard enough. Now, I've just talked about the traditional option, which is a supplement and a Part D to go along with your Medicare A and B. Now, let's talk about my favorite option, option 2. And option 2, to me, is the only option. I'll tell you why. It's because it makes sense. Option 2 is called Medicare Advantage. Okay? Medicare Advantage is what they refer to as Part C. Now, I told you about A, B, C, and D, correct? Okay, what C does is it takes the best of A, B, and Part D, okay, which is the prescription drug plans, and C stands for combine. It combines all three of those entities into one package. And guess what? Most of the time, especially here in Las Vegas, the premium every month to sign up for a Medicare Advantage plan is $0. That's right. There is no premium most of the time. No kidding, no catch. That's just the way it is. Totoo po ang sinasabi ko. Okay? Because I've done this hundreds of times for hundreds of you out there that I've come across in the last almost 5 years that I've been doing Medicare. Okay? I've tried to, number one, educate you. Okay? And let you know that you are not alone in wanting a better option. Okay? So let's go into the Medicare Advantage just a little bit further. Now, do you remember that I said that Medicare A and B only cover 80% of your overall health care, your doctors and hospital visits? And that 20% gap is really what you need to worry about. With a Medicare Advantage plan, here's what happens to that 20% gap, okay? That 20% gap closes, and it almost, not quite, it almost disappears, okay? So meaning to say that signing up for a Part C, which combines Medicare A and B and gives you a Part D, A, B, C, D, okay, will act as or better than the supplement and the Part D that traditionally you would have paid for. Okay, and that's what people are used to. So what happens is, when you sign up for a Medicare Advantage plan, and I'm so passionate about this because I have been able to help hundreds of people in our community. And I'm so thankful and feel so blessed that I've been able to do that for all of you. And because of you, because of all of you that I have helped, I'm on this show today. And I have an opportunity to help even more people. And again, I'm so thankful to you for this opportunity. Medicare Advantage gives you an option to not only close that 20% gap and not really have to worry about that 20%, but in addition to that, Medicare Advantage gives you additional benefits like dental, vision, hearing, wellness programs, transportation by private car, not a bus, transportation by private car to and from your doctor, and if need be, also to the pharmacy to pick up your prescription drugs. In addition to that, hearing aid, the hearing aid benefit, the vision benefit, and the dental benefit have no additional premium monthly and are built in as part of the plan itself. Over the counter, those of you, Tito, and I talk to you about, constantly going to like a Walgreens or a Costco, and, they say, anak, I have to buy these vitamins and, my omega and my calcium and things like that. Well, let me tell you, for the hundreds of you that I helped, you know what I'm talking about already. The over-the-counter benefit is incredible. And over-the-counter benefit with Medicare Advantage means this. Every quarter or every month, depending on the plan, you have an allowance to spend for your personal care items like vitamins and toothpaste, toilet paper even, okay? Personal hygiene things that you would normally pay out of pocket for, those things are covered, okay? Let's talk about some of the big ticket items, okay? Hospitalization. I want to talk about, on a personal level, I want to talk about my father. Unfortunately, my dad, he was so fortunate to be on Medicare Advantage plan, and it kept him healthy and for many, many years, and I was so thankful. And when things did happen, it covered his operations, it covered his hospitalization. But the one big item that all seniors, or really for that matter, all of us have to worry about is hospitalization. When you're on the Medicare Advantage plan, if you are hospitalized for a long period of time, and of course it's not really never someone's choice to have that happen, you are covered 100%. And I mean 100%. Hospitalization is the biggest item, the biggest expense of to anyone that is over 65. And with Medicare Advantage, that is never going to be a worry. It covers 100% of your hospitalization, okay? At very little or zero copay, depending on the plan. Seeing a doctor, it's not going to cost you $40, $50 every single time that you go see your primary physician. With Medicare Advantage, seeing your regular doctor or your PCP, as we call in the industry, is going to be a zero copay all the time. Doesn't matter how many times you have to go. It's a zero copay all the time. When your PCP refers you to a specialist, whether it's a heart specialist, a cancer specialist, an eye doctor specialist, an ophthalmologist, those copays are zero. And, with a referral from your PCP, your regular doctor, those specialist visits are zero. Okay. With your lab work, your diagnostics, like I said, most of your 20% gap is taken care of. You will be left with either no copay or very minimal copays, as that will be your only financial responsibility when it comes to a Medicare Advantage plan and what it covers. Okay, and again, I can't talk to you enough about how valuable the Medicare Advantage plan is or can be to someone that is 65 and over. And let's talk about that Part D for a second. Now, I love this part because you know how you're required. I told you that you're required to have a Part D, to get a Part D, and pay for that in the traditional and the first option, which was traditional Medicare A and B, and getting a supplement and getting a Part D. Well, with Medicare Advantage, Part D has no additional premium. It is included. You have a drug coverage Part D plan included in your Medicare Advantage plan. Okay, so there is no additional premium for that either. So once again, in most cases, there are no premiums, no monthly premiums to sign up for a Medicare Advantage plan. Okay, it already includes, at no additional cost, a dental, a vision, and a hearing plan, and on top of that, a wellness and fitness plan. And the fitness plan works like this. With most plans out there that you're going to run into, they have a fitness or wellness, and the fitness plan works like this. On average, what would it cost you to go to the gym? Planet Fitness or Las Vegas Athletic or whatever gym you have in your particular area, okay? Or EOS, those of you who go to the EOS. As a Medicare Advantage member, okay, you are able to go to a gym of your choice and enjoy a free membership. Okay, and that's a very, very powerful thing. These plans were not just designed to take care of you when you are sick, but more so, they are designed to keep you healthy and keep you from being sick, is what I describe it as most of the time. Okay, now we've talked about how Medicare and Medicare A and B only cover 80%, and it is your choice. The more information you have about how to cover that other 20% gap that's not covered by Medicare A and B, the better off you are. Only you personally know your financial situation. And my job, my passion, is to make sure that you have the information where you can make an educated decision for yourself. And remember, when you sign up for a plan, a Medicare Advantage plan, or any plan for that matter, you are not only making a decision for yourself, you are making a decision for your family. Because you want to make sure that whatever plan you sign up for, that it covers as much as you feel is important to you, so as to not have to go to a family member or your child and say, what am I going to do about this hospital bill? What am I going to do about this medicine I can't afford? Those are questions that I ask people to ask themselves when they're considering a plan. And especially when all the options out there, most of the options out there that you'll find are $0 premium a month. That's extremely valuable. Okay. Now let's talk more about let's see here. Let's talk more about the Medicare Advantage difference. Okay. And again, Medicare Advantage, which they've referred to as the Part C, combines Medicare A and B and gives you a Part D at no additional cost. Now, the common misconception that I hear a lot, especially in our Filipino community, is that, oh no, I don't want to give up my Medicare. I don't want to give that up. I don't want to lose my Medicare. It really is a very common question. And I want to reassure you, all of you out there, kayong mga kababayan ko, kayong mga nagtatanong sa akin sa mga, yung kung saan ko kayo namimit dyan sa mga Seafood City, sa mga Island Pacific, dyan sa mga, our Filipino restaurants. The common misconception is I don't want to give up Medicare. I don't want to give it up. I can tell you with 150% certainty, you are not ever going to give up Medicare A and B by signing up for a Medicare Advantage plan. Medicare Advantage partners with your Medicare Part A and B, okay, to cover most of that 20% that Medicare A and B doesn't cover. That's what it does. That's what it's for. You are not giving up anything. You are merely signing up for a program that is your right as a Medicare beneficiary that will help you with that 20% cost that you normally would have to pay for if you did not have the right plan in place. That's what it is. Kaya kayong mga kababayan ko, please, I want you to really listen to this information. Okay? I've been doing this for our community for going on 5 years now. And I've been able to help so many of you simply because you took the time, and I thank all of you, by the way, you took the time to listen to what I had to say, to listen to the information that I have available. Okay? Yan ang pinaka-importante sa, sa Medicare Advantage, is that you understand how it works. Now, what happens when you sign up for a Medicare Advantage plan is when you sign up for a plan, okay, the Medicare advisor that's helping you should, first of all, they explain how the plan works, just as I am explaining it to you right now, very clearly, okay, and so that you understand how it works and how it can work for you and what it covers, okay? And the other thing is, the other most important thing is this, is your Medicare advisor that you deal with is obligated, and really it's the professional thing to do, to find you a doctor that's going to take care of you. Okay, many of you I've seen out there, you sign up for these plans and you have the right idea, or you don't sign up for these plans, one of the two, and you have the right idea, but dealing with a Medicare advisor, the expectation should be that they explain the plan to you, the different plans that are available, and what it can do in your particular situation, because everyone is different. All plans is not, these plans are not one size fits all. There are plans suited for somebody, for instance, that, say if you're diabetic, there is specific plans for you if you're diabetic or have a heart condition. Say that you have a kidney condition, there's a specific plan for you. So whatever Medicare advisor you are dealing with, make sure that they are asking you these questions, because at the end of the day, it's that advisor's responsibility, it's their primary responsibility to make sure not only that you're in the right plan, okay, but to make sure that they follow up and make sure that you have a doctor that is assigned to you specifically, that takes that plan. And if you already have a doctor in mind, tell the advisor, by the way, my doctor is, this, Dr., let's just say Dr. Calderon, for instance, a great partner in our community. It is the Medicare advisor's responsibility to make sure those things are taken care of. They place you in correct plan. They make sure that you have a PCP, a doctor that you already know that takes the plan, or make sure that they know a doctor that will take care of you and that they have a good relationship with, and that after you have signed up for the plan, that Medicare advisor is able to guide you when you have a question. Every single one of these plans has a member services number, and they have great service staff. But at the end of the day, and I tell my clients this, I am not perfect. I'm not perfect. But I will always do my best to make sure that whatever your question is, it may take me a little while to answer it. I'll make sure it gets addressed. I'll make sure it gets answered. Okay, again, there is no perfect situation, but these plans, these Medicare Advantage plans simply are only as good as the advisor that you're talking to, because it's that advisor's primary responsibility to make sure that plan is right for you. And karamihan naman mga nakakausap ko dyan, they've had different experiences. And I have tried to make sure that I always make sure that if I'm going to recommend something to someone, that it is something that I would be comfortable recommending to my own parents and doing for my own parents. Okay, so those of you out there listening to this program, this first inaugural episode, please remember that when you're talking to your advisor, okay? Because we are here to help you. We're here to help elevate your quality of life and keep you healthy, okay? Now, let's go over something that I went over earlier. A Medicare plan, Medicare Advantage plans, is not a one-size-fits-all. There are plans that are available in your particular area that are called special needs plans. These special needs Medicare Advantage plans work just like a regular Medicare Advantage plan, with the exception of being very specific to your particular chronic condition. Let's just say that you are diabetic and you are taking insulin, and you happen to be on a plan that is, most of the plans out there are designed for, the majority of the people who do not have diabetes. And if you happen to be on one of these plans, they will work only up to a certain extent. But if you have a chronic condition, and this is where the interview part comes in when you're dealing with your particular advisor, that advisor's responsibility is to ask you questions pertaining to your health. And if your answer to me is yes, I'm taking insulin and I'm diabetic, then it's my responsibility as the advisor to make sure that I'm recommending a plan that is specifically tailored to your diabetic condition and chronic need. Okay, and those are called the Medicare Advantage special needs plans. Okay. Now, I don't want anybody to worry. Okay, because we have, like I said, I'm going to take you on a journey in these next, in these upcoming episodes. That at the end of this journey, this is what I wish for you. If you're tuning into this program for the very, very first time, or a replay of this program, by the time we get into, say, the 6th or 7th episode, and I'm going to be covering things, I'm going to be interviewing your local doctors that are on the Medicare Advantage plans. I'm going to be interviewing community partners that are directly impacted by seniors, our community partners, seniors that are directly impacted by the Medicare Advantage plans and the people that it's helped. I'm also going to be highlighting couples that have been married for over 50 years, 50, 60, 70 years. And, one of my favorite things to do is to make sure that we honor the legacy of our kababayans that have made that commitment and have raised their families, and now they have children. And of course, they've had children, grandchildren, and great-grandchildren, and they've taken us through, and they've taken them through the generations. And they, more than anything, deserve the very, very best health care that is available and the very, very best options. And I'm going to introduce you to many different aspects of this community that Medicare touches, because people only look at Medicare for it's a benefit, it's a health benefit. Well, it's more than that. It's more than that. It is a, depending on some of the information that someone has that is a Medicare beneficiary, that can actually decide, if they're going to live a healthier, longer life and enjoy more time with their family. And at the end of every single show, I want to make sure that you guys know that is my goal for every single show, is to educate you on how Medicare Advantage can impact not only your life, but the lives of everyone in your family in a very positive way. Very positive way. Anyway, I want to thank you for taking this journey with me on the first inaugural show of Benepisyong Medicare, brought to you by our very, very proud sponsor, Alignment Health HMO Medicare Advantage. And I'm asking you guys to join me on the upcoming episodes as we explore people and professionals in our community that bring awareness about Medicare and the different things that we can do to enhance and make more positive each other's lives, especially our seniors. And I'll leave you with this. Lastly, during this time of COVID, I've seen a lot of different things out there, a lot of kindness, a lot of unkind things that I've also seen, because of, this, that, or the other thing. I don't want to get political. But one thing I want to ask of all of you is that when you see a senior, not necessarily a Filipino senior, but any senior, please take a moment and really look at them and respect them. Respect them and give them a helping hand if you can. Because although I am not 65, all of us will be 65 and over at some point in our lives. And it is necessary for us to honor our seniors, keep them safe, and do whatever we can to help them live a longer, healthier, and more fruitful life. Because obviously we would not be here if it weren't for them. Thank you so much for allowing me to spend this time with you. And for now, thank you from Benepisyong Medicare. Mabuhay.